straightforward thing, but generally it needs that you need to prepare before you conceive. This is why you need to either you consult, see your doctor, and your doctor gives you the go ahead by telling you the steps that you need to take before you conceive, or you can better still make sure that you do some of those things at home so that you can improve your chances of you getting pregnant. Hello everyone, thank you so much for joining me on this live stream as we are looking at tips that can help you get pregnant. We are looking at tips that can guide you to get pregnant. Sister Antoinette, welcome. Good morning to you. How are you doing? Yeah, thank you so much. So these tips that we are looking at should be made up of your routine checkup with your doctor. These tips you are looking at should be made up of your own physical abilities for you to improve on your lifestyle environmental factors, which can greatly improve your chances of you getting pregnant. Thank you so much, sis. Thank you so much. No, I'm okay. Thank God. So even look at the medical part, because medically, when you see your doctor, there are things that you need to do. We have infections, we have hormones, we have ultrasound, we have some vitamins that you can take in order to improve your chance of you getting pregnant. So under infections, normally chlamydia is a fertility devil, and most people are infected with chlamydia without knowing. That is why it is even a fertility devil, because you could get infected. A lot of people have been infected for over 5 years, 6 years, 7 years, some even 10 years. They only discover when you're trying to conceive and it is not going. That's when they discover that they have chlamydia. So obviously under infections, we have chlamydia, we have syphilis, we have mycoplasma, we have gonorrhea, all the common STIs that you can think of. Those are all infections that can cause you to have difficulties in conceiving. Then the next thing are your hormones. Your hormones. So you check on your hormones. What are your hormones? You check on follicle stimulating hormone, progesterone hormone, prolactin hormone, thyroid stimulating hormone, and it will interest you to know that ladies who have issues with, let me say, nipple discharge, this could be a very big deal for you when trying to conceive. Hey, sis Falcon, thank you so much. How you doing? This could be a very big issue if you have issues with nipple discharge, or when you press your breast, you have a little bit of discharge coming out, or you see breast milk coming out from your breast. This could mean that you have serious issues in terms of your hormones. Maybe you have issues with your prolactin hormone, and prolactin will cause a lot of problems when it comes to hormone imbalance. So it is necessary that you do all of these issues, you do all of these checks before you actually start pregnancy, before you actually start maybe looking at the fact that you want to conceive. You have hormones like your progesterone hormone. This hormone is a hormone that prepares you at ovulation. At ovulation, you have the womb that will thicken to wait for the baby. And this womb, when it thickens, it prepares you for for implantation after fertilization. A lot of ladies will actually have miscarriages when they actually conceive, because you have issues with these hormones thickening, and because of this is going to cause a lot, which therefore means that you might actually have a miscarriage without actually knowing, just because your hormones were not there, the progesterone was not there to thicken and receive the egg when implantation occurs. So when you do your STIs, you do this hormone check, the next thing that you can possibly do in order for you to prepare is your ultrasound. Ultrasound is echography. That is, you do echography, ultrasound, to look at the vital organs of the reproductive system. Look at the womb itself. How is your womb? You look at you look at the ovaries. You have ovarian cysts. And if you have ovarians, for example, your doctor will advise you exactly on what to do. If you look at the womb and there is anything with the womb, maybe it's fibroid whatsoever, your doctor will advise you on how to move forward. If you've done like that, the next possible tip that you can do if you're trying to conceive is you get some vital vitamins. Some very important vitamins. You can take folic acid, start taking folic acid. Folic acid will improve your chances of you getting pregnant. If you've done all of that, all of these tips, they're going to prepare you for pregnancy. But take note, your lifestyle, your habits, the way you eat, the way you drink, where you are, all of that also will affect you if you are not prepared. Let me say you drink. Drinking can affect you, it can cause you to have fertility issues. Smoking can affect you, it can cause you to have fertility issues. And in terms of smoking, there are people who maybe you don't smoke, but you live beside someone that smokes. You, you're clubbing and you get into club because of this, the nature of it. You inhale smoke from here and there. Obviously, it's going to affect you. So, looking at all of this, you see that your preparation includes the medical as well as your own physical preparation. So, under the medicals, we made mention of infections, which are the various STIs, chlamydia, mycoplasma, syphilis, gonorrhea. All of these are all STIs that can cause you to have issues with your fertility. But when you look at them, and each of them can be handled, once it is handled, you now have an increased chance of you getting pregnant. The next thing in terms of the medicals that you look at is the hormones. What are the hormones? We have follicle stimulating hormone. We have, passive smokers. Passive smokers. Yes. Yeah, there's also nipple discharge. Nipple discharge. You know, at times ladies don't take little things into consideration. Nipple discharge has caused a lot of ladies in terms of them conceiving. So if you have nipple discharge, it is important that you get to your doctor immediately. Don't assume that no, it's just normal discharge. No, because if it is related to increased prolactin, then if you're trying to conceive, you have serious issues because hyperprolactinemia is something that affects your fertility negatively. It causes serious hormone imbalance because for the fact that the prolactin is up, that's already hormone imbalance. It therefore means it is higher than usual. So that's already hormone imbalance. And prolactin itself will now distort the other hormones. So if you have it, it is proper that you get to your doctor immediately. So if you see nipple discharge, get to your doctor like immediately. Talk with your doctor and let your doctor see what to do with it. So like we're saying, before you conceive, get these tips, visit your doctor, run STIs checkup, run hormonal checkup, run even physical examination, like we're talking about the nipple discharge and so on. And then you also do your ultrasound. Ultrasound is echography where you check your vital reproductive organs. By the time you do all of this, you can now go now to the physical and environmental factors, which therefore means physically you have to be fine, environmentally, your what you eat, what you drink, what you smoke, all of that have to come to play. If not, you might have serious issues with you conceiving. Then, in terms of what you eat as well, we encourage you to take a lot of vegetables and fruits. This is going to improve your fertility greatly. A lot of vegetables, a lot of green leaves, all of it going to increase your fertility greatly. Fruits, a lot of oranges, a lot of bananas, a lot of watermelon, all of this is going to improve your fertility greatly. So we encourage you, please go home and you do all of this preparation before you conceive. Don't just go ahead if you've not prepared. It is good to prepare before you conceive because you might actually have chlamydia, for example, and this chlamydia can cause you to have ectopic pregnancy, which therefore means that what you will actually conceive, but that pregnancy could stay in the fallopian tube without coming down. And if the pregnancy stays in your fallopian tube without coming down, it will cause you to have serious pains, and this falls under ectopic pregnancy. Ectopic pregnancy is not a good deal. You feel a lot of pains, and your tubes could be moved out. And remember, if your tube is out, one of your tubes are removed, it makes it difficult for the other one. It's not like you will not conceive, but it makes it difficult for the other one because you will now love just one tube, which therefore means if that one, if you don't have any ovulation taking place in that tube, then conception becomes so difficult. So, for those who are following, thank you so much, Sister Antoinette. Thank you so much for being here. That was a tip I have for you people today. I hope if we have more tips, we are going to share here. Thank you so much for being there. May God bless you. Do have a blessed day. Do take care of yourself. Remember, once you check your health, you will remain wealthy. Check your health and maintain your wealth. If your health is not good, obviously, no matter how much you get, you will spend it all on your health. So it's always good to check your health and make sure that it is good before you proceed anything in life. Thank you so much for being here. May God bless you. Have a blessed day. But please, do you have any question? If you have any question, just go ahead, sis. Maybe I may want to just conclude things when you have a question. Please, if you have any question about it, just go ahead. Can ovulation take place in both tubes at once? Yes, ovulation can actually take place in both tubes at once. That is, you have ovulation being released on the left and ovulation being released on the right. That in that case, that's where you have unidentical twins. So non-identical twins are twins with when you have ovulation on both tubes. So one sperm cell fertilizes the one on the right, another sperm cell fertilizes the one on the left. In that particular case, you have John and Mary, or Suzanne and Stanley, or Asana and Usaina, or whatsoever. So it is possible for ovulation to take place in both tubes at the same time. It is also possible for ovulation to occur a little. It might take, maybe you have the first ovulation and then it takes about maybe hours before you have another ovulation, or maybe a day before you have another ovulation. And in that case, it is dangerous for ladies who are not stable. Okay, if you are not stable as a lady and your ovulation occur today, it make like 2 days or a day, another ovulation. If you met with John today and tomorrow you're meeting with Stanley, it is possible that you can be pregnant for 2 different men. It is possible that you can be pregnant for 2 different men. And I think I did that presentation here when I was saying that it is possible for you to be pregnant for 2 different men. This is the reason. You could have ovulation today and you have another ovulation tomorrow. So meaning that you have intercourse, the sperm cells will be, the sperm cells can be fertilized today, and another sperm cell for another person fertilizes the egg for tomorrow. So this is possible. This is possible. So is there any other question, please? If you have any other question, please go ahead. So we all need to be careful as ladies, because you might just be okay. You might just say you are fine, and you might just be happy that you had twins, only for you to realize that these twins were not all from your husband, from your partner. Maybe one was from the side guy, and that is pretty difficult for you as a lady. How are you going to move on with that? So if you have any other questions, sis, go ahead, please. If not, we will be calling off the discussion. If any other person has a question, please you can go ahead. If not, we're calling off the discussion. So we have been looking at tips for you to get pregnant and how you can get pregnant and how you prepare for pregnancy. So we talked about the fact that you see your doctor for some checkup, and this checkup is physical and medical. Medical, you have some tests to run to check for your STIs, to check for your hormones, to check for the vital reproductive organs like your womb, that's the uterus. What? Uh, yeah, according to the resemblance, that's true. Identical twins are more likely twins from the same egg. But it is unfortunate that you can have some identical twins that are you can have non-identical twins that are from the same egg. You're from the same egg, but you're not identical. You're not that identical, but you're from the same egg. Thank you so much, Anand, a lot. Yeah, you're welcome. You're welcome. You're welcome. Thank you so much for being here. Thank you so much for pushing. For the fact that you're here, at least makes it easier for me to at least go further to explain the other questions you're asking. So thank you so much. Do have a blessed day. Thank you.